Welcome to the State of Hawaii Title V Priorities Summary. Let's take a look at our evidence-based priorities, strategies, and outcomes as of August 23, 2017. Based on the 5-year needs assessment, Hawaii selected at least one priority health issue for each of the 6 Title V population domains moving across the life course. For women and maternal health, Hawaii selected promotion of reproductive life planning. For perinatal infant health, reducing infant mortality through breastfeeding and safe sleeps promotion. For child health, developmental screening targeting 0 to 5-year-olds. For adolescent health, the focus is to improve development, health, safety, and well-being through wellness visits. And for children with special health needs, the focus is transition from youth to adult care services. For the last cross-cutting domain, priorities selected include to improve the oral health of children and pregnant women, improve the use of telehealth across FHSD programs, and capacity building measures selected include improving family, consumer, and partner engagement by FHSD. Priority 1, promoting reproductive life planning using evidence-based strategies to encourage the use of long-acting reversible contraception, LARC, as part of reproductive life planning, and the one key question, would you like to become pregnant in the next year, as part of preconception healthcare visits. One key question training has been widely accepted with over 300 participants trained since last year and 2,706 individuals reached in the first year. Another success was the issuance of a memorandum by the state Medicaid program with guidance on coverage of contraceptives, including improved reimbursement for LARC and supporting OKQ use. Plans include a continuation of OKQ training and addressing ongoing training needs, continued collection and analysis of OKQ data, and development of public awareness messaging on healthy behaviors to support reproductive life planning and preventive women's healthcare visits. Priority 2, one priority for reducing the rate of infant mortality is to increase the percentage of WIC infants ever breastfed. The key strategies to do this are to strengthen programs that provide mother-to-mother support and peer counseling, and to use community-based organizations to promote and support breastfeeding. To date, WIC has strengthened support for mothers by offering a Train the Trainer workshop on teaching baby behavior to hospital staff and community organizations, and increasing the number of WIC staff who have attended the lactation counselor training, and finally collaborating to convene stakeholders to develop a state breastfeeding strategic plan. Moving forward, our activities are to obtain endorsements for the State Breastfeeding Strategic Plan that address different parts of the breastfeeding life cycle and to finalize the accompanying work plan. Outcomes include funding and establishing a designated state breastfeeding coordinator. Priority 3, reducing infant mortality through safe sleep. The focus for safe sleep promotion is to ensure Hawaii's birthing hospitals have established policies and protocols, integrating education into WIC programs, and ensuring training and adequate resources to effectively implement recommended safe sleep protocols. Our accomplishments include partnering with the Perinatal Nurse Managers Task Force to review infant safe sleep policies at birthing hospitals, as well as convening safe sleep advocates, agency, and community partners at an annual Safe Sleep Summit to raise awareness of best practices and coordinate activities. Future plans are to increase infant safe sleep knowledge for caregivers and training professionals working with parents, and collect information on infant sleeping behaviors among the diverse cultures of Hawaii. Priority 4, increase developmental screening and services. The priority for developmental screening is to increase the number of children receiving developmental screening and services, with the evidence-based strategy measure looking at creating a data sharing system for Title V programs to track data on screening, referrals, and services. A key accomplishment was to establish the data system with MCHB Home Visiting, CSHNB Hi'ilei Program, and EI Section. Home Visiting and Hi'ilei work with parents to complete a developmental screening questionnaire. Data from these programs helps us improve our outreach and targeted efforts. Our plans moving forward are to continue building our data system by working with partners on data sharing agreements and refining our internal data system. We will also be working with families and parent organizations to develop family-friendly materials on the importance of screening and child development. Priority 5, reducing the rate of child abuse and neglect from ages 0 to 5 years. Strategies are to reduce the percent of children in home visiting programs with injury-related ER visits and provide effective and data-driven training and technical assistance to promote and nurture safe, healthy, and respectful relationships. We have established an actively engaged violence prevention collaborative with home visiting, sexual violence prevention, domestic violence prevention, and child abuse and neglect prevention programs. As a springboard to hope, we also created a public health training framework based on adverse childhood experiences. By using valid and accurate data, we hope to inform and evaluate program activities, infrastructures, and policies, and prevent child abuse and neglect by building the foundation and infrastructure to support safe, healthy, and respectful relationships. Priority 6. There is an art and science to improve the development, health, safety, and well-being of adolescents. The development of an Adolescent Resource Kit, the ART, with a corresponding training and education series, the Science, are the strategies being employed to enhance the skill base and knowledge of PCPs to maximize any adolescent visit. The ART includes links to age-specific mental and sexual health care and confidentiality rights. Through provider surveys and adolescent focus groups, physicians mention the need for local referral and self-care resources, which are included in the ART. Webinars and trainings by our partner, the Hilo Pa'a Family to Family Information Center, included SBIRT and a survey on whether annual visits should replace sports physicals. Hawaii's pediatricians were 54 and 50 against. A major systems culture shift will be needed to move the adolescent well visit needle and to continue to set the stage for successful visits for all. That means, for example, addressing confidentiality issues, minimizing health plan coverage discrepancies, and using broad-based screening tools. Priority 7. Promote transition to adult healthcare. The major strategies for this priority are standardizing procedures and data collection and infusing priority into the standards of care of other community partners and agencies via collaborations. In the past year, we have developed a program transition policy and a new database is almost live. Eventually, it will capture transition information. Our desired outcomes are for healthcare to be completely integrated into planning for adult life across the agencies, and for children and youth to be actively prepared for greater responsibility and independence as they get older. Priority 8. Improving oral health of children and pregnant women. The two strategies are establishing leadership and staffing for the state oral health program and completion of the pilot teledentistry project at WIC and Head Start programs. FHSD is excited to announce the hiring of a dental director, Gavin Uchida, and is equally excited at the progress made by the Virtual Dental Home project that successfully provided teledentistry services to 277 children to date. West Hawaii Community Health Center, the service provider, has submitted Medicaid billing for services under the new state telehealth law. Future plans include hiring a full-time program specialist for the SOHP and successfully demonstrating the effectiveness and sustainability of the virtual dental home in Hawaii and expanding to other locations. Priority 9. Increase the use of telehealth. Strategies for increasing the use of telehealth are workforce training, infrastructure development, and provision of services, education, and training. Online and in-person telehealth training has been developed and will launch in October 2017. FHSD offices statewide have video conferencing equipment installed with Zoom, a HIPAA-compliant application license. The system is being used for administrative meetings, provider education, for example, speech therapy for EIS providers, and provision of services to start by the end of 2017. Next steps and plans include continuing enrollment and training of Title V program and coordinator staff using the training program, and expanding telehealth services in state, such as nutrition services. Priority 10. Improving family and consumer engagement in FHSD programs. Improving family and consumer engagement in FHSD programs is one of two capacity-building state measures selected from the needs assessment. Accomplishments include the graduation of the first cohort from the FHSD-sponsored Parent Leadership Training Institute, an evidence-based program, to cultivate a sense of civic engagement among parents. Assessment of Title V family engagement activities indicated staff need more training on recognizing and planning for family consumer engagement. Future plans will be to integrate the PLTI graduates into FHSD programs and inclusion of family consumer engagement activities in all Title V priority issue work. Developing truly effective partnerships to implement FHSD programs is the other capacity building state measure. Promoting partnership is a foundational tenet for maternal and child health agencies. Our accomplishments include identifying key partners for the Title V priorities through completion of our work plans. Our future plans are to identify best practices for partnership within the division and use for workforce training, and to effectively engage more partners to advance Title V priorities.